Okay. Hi, I'm Dr. W. Danny Robertson, one of the older physicians here. I started in August 1st, 1973, took over Dr. Robert Smith's office right by the Keys Pharmacy, across from the cemetery, and came in there. And I was one of the very last physicians to graduate and just come out and hang a shingle. Uh, I interviewed a nurse and a secretary, and we went out and set up our office. So we didn't have to worry about as much administration things as there are right now. But it was a good place to start, and there was big differences in this. Dr. Gary was the dentist that was starting right next to me. So I went over that day, August 1st, and say, "You're starting here, I'm starting here. How about we take care of each other for the next 50 years or so?" And we did. I delivered his kids, and he took care of my teeth. So it was a good relationship we have. But there's a lot of differences since I've been here. Of course, we didn't have to worry about pre-authorization and insurance at that time. We didn't have to, especially didn't have to get authorization for CAT scans or MRIs, because we didn't have that CAT scans and MRIs. If you want to know you had a brain tumor, we had to inject air in the spinal fluid and sit you up, and then see the bubble that would occur above the brain to see if there was a bulge. So that was where the brain was. And ultrasound was a brand new thing just coming out. And I remember in medical school, they showed me a hazy picture of a round circle. And it says, "This is an actual baby's head. You're able to get the circumference of the baby's head from this picture." That's not going to go very far. But they finally brought out ultrasound, but it was very cautiously brought out. If you wanted to get an ultrasound on a pregnant woman, you had to have very strong indications, because we didn't know that in the future if this was going to harm the baby's hearing from the high frequency ultrasound. So it was nowadays you want a picture of your baby in utero, you go to your doctor and he takes a picture of it, So things are a lot easier at that point, because I delivered about 1,200 babies. And not having ultrasound, I was surprised with twins. You get the baby out, and I said, "Oh my, we have a little surprise here." So yeah, and that's unfortunately one of the things that insurance has changed. They came in and told us that we no longer could be delivering babies without increasing our malpractice insurance up to $100,000 from $21,000. And so we had to shut down, and we had to get rid of 79 pregnant women. We had to promise them we'd be there for their delivery, but we couldn't deliver the baby, even though we had delivered 2 of their previous babies. So one of the little downsides we've had. And we used to assist in surgery as well, too, until the insurance company decided that wasn't a good idea. The other was in blood testings. That sure has changed. We used to, in order to determine liver function, we had something called bromosulfothioline, as BSP, and it was a dye you'd inject, and then the liver would clean that out, and then you draw the blood and check for the amount of BSP. And the BSP would turn purple in alkaline. It was clear. So you do this inject, and you go to wash your hands, and everything was purple afterwards. And in order to determine how jaundiced a patient was, you drew blood and you held the tube up, the serum up to the light compared to color charts. And that told you what the bilirubin was. So, and when I came out here, we weren't doing blood gases. I mean, now you just routinely get a pulse ox every time you go to the doctor, but that was unheard of when I came here. We didn't have any idea what the oxygen levels was or anything like this. So I gave a little talk on oxygen levels, and we just all decided that's a good idea. So we started doing blood gases. We also inserted the first pacemaker when I came here too. And then we created our first 4-bed intensive care unit, and they tried to limit that. The doctors that had admissions to it, and that didn't go over well with me, because I had just finished my residency managing a 40-bed intensive care unit at Akron City Hospital. So that was one of our little conflicts. Yeah, my first office was down at 750 East Washington Street. That was from 1973 until 77. That's when Roy Miller joined me. And he was just an excellent person. Then when he joined me, we went down then to 21.5 South Court Street, just starting down the hill. That's where the new hotel is being built now. So our office is gone. And one day we were very busy and our toilets overflowed. And we're trying to mop this up. And we hear a little rap, rap, rap from the back door. And it's Lynn Midsell with an umbrella because his office was below our office. Yeah, one day I was examining a patient there, and I heard the nurse screaming out in the hall. Yeah, and I come out, and there's this child is blue, and he's not breathing. And I grab him. I said, "Give me the intubation tubes and everything. Get ready to intubate him." And just as I turned his head, he started to breathe. I said, "Okay, I don't know what it is, but we're not moving this head." Got the ambulance, took him to Children's Hospital, and there was a brand new thing. They were able to communicate with the ambulance to the hospital. They had a telephone apparatus at that time, which was a fantastic invention. And they told us, we were able to tell them what we had coming, and they were all set. And it turned out they did an emergency tonsillectomy. This child just had huge tonsils and was obstructing his airway. So kind of a little yeah, I've remained at the Akron City Hospital for the past 55 years as a preceptor. I work with the residents as they come out of medical school and until they graduate at the end of the 3 years. And it's getting to the point now that all I can really teach them is my mistakes. And so, but I then was able, over the 55 years, to take some of the best residents to join me. So we joined with Roy Miller, John Cerso, Glenna Jackson, Lisa Esterly, Andy Chemba, and Kristen Kranz. They all join my group now, and it's still sort of in operation. But it's completely changed how quickly they went. Last week, I went down to my new office to get my annual physical, and my doctor is now the resident that I took care of. And as I go in, the secretary says, "Oh, William Robertson? Yes, just sit over there. We'll take care of you when we get a chance." This is my office. But you think my history is old. It's not at all as Dr. Lynn Mansell. He was a true gentleman. When I was here, they gave him an award for 55 years in practice. He started here in 1929. And I kept asking him, I said, "What did you do with things like glaucoma?" He said, "We didn't have glaucoma. People just went blind. We don't know why. They just went blind." I said, "What did you do for urinary tract infections?" "Cranberry juice." "What would you do for pneumonia?" "Mustard plasters." He says, "I tell you that one day," he said, I got on my own Model A4, took my old x-ray machine down to where 18 and 71 is now, and took a picture of a farmer's wife that had fallen. And it came back, I developed it, and I had to go back and tell him, "I'm sorry, you broke your hip. There's nothing we can do. You're probably going to die. You just have to stay here until you throw a blood clot and die." And that was about it. But even when I came here, if you fell and broke your hip, we had Dr. Zuhair Yussin came out once a week, would come out and do orthopedic surgery. So if you broke your hip on Wednesday, or you had to wait until Tuesday to get your surgery done for him to come out. Remember? So things have changed a little bit. That's where Dr. Ebner coming in was just a grace. It was just a wonderful. All of a sudden, we had our orthopedic doctor here. So he asked me what some of the upsetting things are, and that I've seen over the past few years. And I guess the most upsetting thing is the insurance companies are now dictating what we can do and what we can't do, and how long we can keep a patient in the hospital. My first experience, I was down the hall, and the nurse says, if you're going to keep this patient in the hospital another day, you have to talk to the insurance company." I said, "I don't have time. You're the head of insurance utilization." She says, "They will only talk to you." So she said, "What is the problem?" I said, "Well, I admitted this lady, and I went through very complex medical terms on her arrhythmia that she was having, a very dangerous irregular heartbeats, and we had to put her on a new medication. to control it, but that medication might cause even a worse heartbeat. And we did, and that's exactly what happened. She went into a dangerous heartbeat. We had the defibrillator. So we were going to keep her there for another day and try another medication. And I explained this to her, and she says, "You say there's something wrong with her heart?" And I said, "Yes, she had a heart that was beating bad, and we wanted to put her on a pill that made it beat better, but we made it beat worse. So we want to keep her in the hospital for another day to put her on another medicine, but it might make her heart beat bad too." She says, "Well, I'll have to talk to the doctor and get back to you." And of course, when I started, my malpractice went from $400 a year to $21,000 a year. You think that's not too bad, but what if your automobile insurance went from $40 a year to $21,000 a year? So, they also, insurance companies, kind of, as you know, very well know, they limit the amount of time that you can have with your doctor, and he spends so much time on administration. So if you came out for your annual physical and you had a suspicious looking mole, I said, "Come on, let's go across the hall and we'll just take that mole off right there." Well, now you have to reschedule that. And computers have really taken over. If I admit a patient in diabetic ketoacidosis, which means their diabetes is out of control, they just push a button now, and the insulin dose is figured, the potassium levels are figured, the blood gases are ordered, the blood sugars are all ordered. They just sit back there. And if I admit a patient with a community-acquired pneumonia, I have to validate why I don't want to use this antibiotic that they prescribe. You must use this antibiotic, and if I don't want to, I have to be able to tell them why I am not going to use this antibiotic. So, and the other dismantling thing was when Cleveland Clinic shut down our obstetrical department. You know, we were delivering 400 babies a month, but we had to deliver 600 to make it apparently profitable for them. So we really missed that. And now our women all had to go to Fairview or Akron City when they're just about ready to deliver. And so that was the other upsetting thing. But what is good in medicine is the advancements we've made in diagnosis and treatment now, you know, with MRIs and CAT scans, and they're able to treat genetic diseases now like muscular dystrophy and sickle cell anemia and things that we wouldn't even consider that. So it's made a tremendous advancement. And so I think the new medical students are adjusting to it. They're learning to run computers very well, and I tell them that just as the last thing with the medical students, they want any advice from me, I say, just remember to always put the patient first. Always put the patient's interest, regardless of what the insurance companies tell you, regardless what other outside influences are. What is best for the patient? And that's pretty much the way I ran my practice for 55 years. Thank you. That's all I have to say. Another overflow?
Oh, yeah, we got another. I came up there with a big umbrella that morning, and I thought we missed this when you moved.
Oh my.
You know what I found interesting is that what you said and how practice was in the early 70s. I mean, that's like modern time.
Yes, right.
It sounded like early 1900s.
Uh-huh.
It's amazing.
Yeah, we weren't doing blood gases. The blood tests we did were very crude, and
You came in 73, right?
Right.
And Roy came in 76.
So no, he came 3 years, 80. He was here.
No, he had to come in 76 because I came in 77.
Right. Yeah, well, that's right. He's 77 to 79. Yeah, he was with me 77 to 79.
I remember calling him when I moved from Steubenville, and I called him because I went to school with him and his brother, and I asked him, "What do you think? I could start an ophthalmology practice here." And he said, "Can you start on Monday?" Yeah.
Oh, he was an Amish fellow, and we're setting up the office, and he just grabs this board and he cuts a beautiful scroll out of it, puts it right in there and everything. And I said, "How did you learn it?" He says, We're Amish. We're born with a hammer. And a great administrator, because he got the medical building going. Farnham tried to do it, Mansell tried to do it, and you couldn't get 18 doctors to agree on anything. And he came up with the concept of building a medical building. The hospital would own the medical building, but the doctors would own their own offices. And that was unheard of at that time, that we could invest in ourselves instead. I remember going into the library, we had 18 doctors, they were all sitting there like that, and they weren't gonna give up. But he was able to take it and really run with it. He was a tremendous. So when he just told me, he says, you've got everything you need here. You have all the specialists. We haven't had a new doctor in Millersburg for 10 years. He says, I've got to go back there. I said, sure, that's great. And I'd cover for him, and you look out and all the horses were lined up in front of the office, and I'd asked this woman, I said, well, you're 38 weeks pregnant now. You're starting to dilate. Can you come back and see Dr. Miller next week? And she looked at Emil, and yes, Emil says I can come back next week.
Did you get the calls? We used to get letters or postcards in the mail from the Amish down in Holmes County.
Oh, really?
Wherever it was, and they'd say, we're going to bring Abe in for an eye examination on next Friday.
Yeah.
We'll be there in the afternoon sometime. And we always had scheduled that you'd come at such and such a time.
Right.
You couldn't call them back. You couldn't call them. You'd tell them you just said, okay, whatever it was, they'll be here.
Right.
Pull the buggy up.
Right. The buggies were parked outside of Ebner's office and your office. Yeah.
There we go. Yep.
Yeah, because I covered for him the weekend. He says, I've got 3 women that I promised I would deliver at home. Would you do that? And he said, well, let me tell you right now, there is no such thing as malpractice. If the mother dies and the baby dies, that's God's will. You've got an IV and you've got a foot pump for vacuum, and that's all you got. I said, yeah, there's no malpractice. This is great. I'll do it at home. Yeah. Bring out the hot water and newspapers. You betcha.
What year was that?
79, 80. Mm-hmm. Mm-hmm.
Rick Rose is still doing the hand surgery in the kitchen on the table.
Oh, really? Is he?
Yeah, he's still doing it.
Oh.
He's still doing it.
Yeah, I had one. They called me a farmer cut his extensor tendon, and I said, well, we'll have to ship you down to the hand surgeon in Worcester. He said, oh, you can do that. I said, well, I've read about it, and I know the technique but I've never repaired a tendon. He's, oh, go ahead and do it, So I always ask, how's that farmer? He said, oh, he's fine. His fingers don't. So it was the other thing that Roy wanted. He could do anything down there. He was not limited. You didn't have everybody watching over your shoulder.
They'll never see one
No.
way or the other.
No.
It doesn't matter what it is, they'll never see.
Mm-mm. No. It's just a whole different way of thinking down there. It's just delightful people to work with.
I used to get all the kids with strabismus. They come in with their eyes crossed like this because there's so much inbreeding.
Yeah.
Down there that they end up with all kinds of diseases because of the inbreeding.
Mm-hmm.
And, good people.
Yeah.
People.
Yeah, they are good, solid people. And they paid in cash. Yeah. Mm-hmm. Because they had all this money. They were, farming, and they brought in so they didn't have to buy any food. They didn't have to pay for electricity. They didn't have to pay for cell phones. They didn't have to, and all they did was make quilts, and they would sell these quilts for thousands of dollars,
And they're beautiful.
They're absolutely gorgeous. So
now they have to buy their electric bikes.
yes.
Electric bikes, solar panels.
Yes.
On the barn, and cell phones that's charged by the solar panel, so that's okay.
Yeah, it's DC. It's not AC. That's okay.
Yeah.
Mm-hmm. Yeah. Yeah, we saw the last of the golden age of medicine. You just did what was right. Yeah. Like I say, I had a 90-year-old that had a GI bleed, and at that time we didn't do colonoscopies. You did an upper GI and a lower GI because I didn't know where it was coming from. And I told utilization, I want to admit that. She says, why? Is he bleeding? I says, no, but he's 90 years old. He has nobody to take care of him. He has no way to get prepped for it with enemas and everything else. So I want to put him in and no, we can't do that unless he's actively bleeding. You're not allowed to admit him. I was like, geez, if this was your grandfather, how would you like this? It's just, but we did. We just did at those eras what was right for the patient. We didn't,
Yeah, before they did the colonoscopies, remember you used to use the sigmoidoscope?
Oh, yes.
I still remember
Me?
you, and I'm on the table, pull my legs up, got the proctoscope, and you stick the proctoscope in, and he said, you know what? I bet you there's a lot of people in town that would love to have you in this position.
And he says, when we're done, will you tell Nancy you didn't find my head up there?
Oh, my.
You're right. That's what we always did with sigmoidoscope. We didn't have colonoscope, so it's like doing a mammogram only on the right breast. You know, we don't want to. Now with the colonoscope, they do the entire thing. So
I'm still amazed. I mean, it just seems like primitive medicine almost compared to today.
Mhm.
Yeah. Well, until what, 1920, something like that. If you were diagnosed with diabetes, that was a death sentence.
Oh yeah. Yeah.
And anything you couldn't do. You couldn't do a thing. Nobody had discovered the medications to control the insulin.
No.
And you just died.
Right. That was it. You've been on a strict diet, and but that prolonged things maybe a month or so.
Maybe a month or so. As far as you'd ever get.
Right. And like I say, that's.
Get pneumonia. R.L. Mansell used to say the only thing I could do was sit to the bedside and hold their hand while they died.
Mm-hmm.
And that's not that long ago.
Yeah.
You're saying it. It's just like,
No.
I mean, we all remember it. I mean,
Yeah, he was telling me about an older farmer out here that developed pneumonia with mustard plaster and everything on it, and then he took care of it, and then the wife contracted it, and they both died. Within a couple of days of each other. Nothing you could do about it. You just put mustard plasters on and held their hands, and that was it.
And what was the purpose of mustard plaster?
It draws out the infection.
My dad loved it.
Really? Yeah. Mustard plasters.
Yeah.
Mm-hmm.
We always had a stock
Oh, Dr. Mansell just had quite a practice, because we always were so honored with it. I couldn't call him Lynn. I tried once to call him Lynn, and I choked on it. Yes, no, Dr. And we would cover for him when he'd leave. And oh my gosh, all these people would just crash when they go, oh my God, Mansell's not here.
Speaking of which, I just talked to them at the hospital earlier this week. And when it comes time to do our display, we have two, I think they were done by, you remember Elmer Zarni? Yeah, Elmer Zarni. He did the assemblages.
Oh.
So there's two assemblages with RLs. This one and this one, which is the front door of his office. They're about this big and about this deep.
Wow.
And we can have them in springtime.
Who has them today?
It's at the hospital. They're at the hospital.
Oh.
And we still have them here.
Oh.
Then I've got one from Elmer that did with like eye stuff too.
His work is great.
Oh yeah. Three of Elmer Zarni's things that we'll be able to, but they're going to get huge. We'll probably have to set them up on here because they're bolted to the wall of the hospital now. But they're going to take them down when we tell. I told them we didn't need them until spring. Right? So those will be good.
Great.
Yeah. What is Charlotte Carson's name now? Starts with a K or something? No.
Diver.
What is it?
Diver.
Diver. Yeah.
Yeah.
Is she at Western Reserve?
Yes. Well, that was her last address. I don't know if she was there because of
Has
therapy.
anybody talked to her about Andy?
We haven't yet, but she was on our list, I think, originally.
Okay.
She's still, she's an active member here.
Yeah.
And
Yeah.
I'm sure she'd probably sit down and chat.
I wonder if she has some stuff too, probably from Andy.
Yeah.
Because that's another story.
Andy and Irene and Dan Leskowitz, they ran this town. That was it. Mm-hmm.
But whatever you had, except for eyes, Andy Carson would do it.
Oh yeah.
The hip done, Andy Carson would do it. You needed a whatever.
Yep. Mm-hmm.
On
Yeah.
the sidelines of every football.
Oh yeah.
game.
Yeah.
All the sports physicals were done. And
Yeah.
He was real. He took care of the county home residents.
Yeah. Oh yeah.
Yep.
So I think we definitely need to find some stuff.
I can get in touch with her.
Yeah, he would be the only one that would come in the ER. And by the way, the morgue was right across from the ER. It's a little spot in the back there. Yeah.
And when I first came here, I wasn't sure I could tell the morgue from the ER.
Yeah.
In the basement, remember, of the hospital?
Uh-huh.
Oh,
Basement and in the back. Well, Andy Carson, he had Roy parked in Andy's parking spot once. And Andy came in and says, I dug that spot out by myself with a shovel. That is my parking spot, and nobody has to park in that spot but me. So a week later, Roy Miller got a big plastic plaque and he glued it on with industrial glue. Private parking for Doctors Miller and Carson only. You can still see the little pieces where he took the screwdriver and had to peel it off. Oh, yeah. Yeah, we've had some interesting. My most interesting letter was from a patient, and when I retired, she says, Dr. Robertson, you delivered me. You were the only doctor I ever knew growing up as a child. She says, you just delivered my baby. I just assumed that when I was an old lady in the nursing home, you were going to be my doctor. So
I think that's the beauty of family practice, because Dr. Tuziak said those exact same things.
Mm-hmm.
Family practice.
Yeah, there's something about delivering a baby and watching that baby grow, and we were the only ones sent flowers for funerals for our patients, and they always say, is that admitting malpractice? No, I think they just did. I really love Mabel Gormans, and she was a sweet lady, and I like to send her flowers.
I think I still have a letter at home.
Oh, yes.
That you wrote me. I'm going to have to pull that out.
To Mabel Gormans,
Yep.
Had all kinds of horrible things wrong with her. Everything that ophthalmologist hates.
Yep. You referred.
Well, that's.
Who was a non-existent patient.
Oh.
Well, they did to me when I graduated from the Family Practice Center. The next day I was coming to Medina to open my practice. And they said, that's it. I said, it's my last patient. I'm done. They said, oh, Doctor, I'm really sorry, but one more patient called from Medina. They want to be your patient. And we worked them in. I said, oh, all right, okay. And I picked this chart up, and she's 375 pounds. Her blood pressure was like 300 over 120. Her urine showed 4+ sugar. Her chief complaint was, I am just so tired. I said, how could you do this to me? How can you do this to me?
First person in your practice.
Oh, no. I go in, I open the doors. Hi, I'm Dr. And there's our director with a babushka on, up in stirrups. So I did that each year. We picked out one of the senior residents, and we would do that. And I would sit there with a babushka on. Oh, they had a good sense of humor, everybody. Yeah, I forget what that. Yeah, it was Mabel Gormans. You're right. That was the name of this patient.
When we came here, everybody knew, all the other docs knew their wives, knew their family.
Well, even the lawyers. We had Dr. Lawyer.
Yeah, we had Dr. Lawyer golf out.
Yeah. Mm-hmm.
Not now.
Right.
Not now. We did other things, Dr. Lawyer. What else was it? We did the golf outing and something else.
Well, that Wedgwood, we have a dinner once a year, at least, with all the lawyers and all the attorneys we get together. Yeah, we even had one of the attorneys scrubbed in on surgery, and they nicked an artery, and it was a major bleed and everything, and they were able to control it. He says, if I hadn't been there and seen what it was really like, he says, I would have been willing to sue on this case. He said, but knowing what it's really like in surgery and how difficult it is to know exactly what you're doing and how easy it is to nick an artery, he says, I just have an entirely different appreciation. And that was our relationship. Doctors and lawyers, we got along real well.
Some other not so good things. Remember the medical staff thing? We used to have ashtrays on all the tables.
Had what on the table?
Ashtrays.
Oh, yeah. Oh, sure.
Yeah,
sure.
Everybody was smoking.
Oh, sure.
Mm-hmm. You could smoke in the hospital.
Oh, yeah. Sure you could. Yeah.
Does anyone remember the original hospital? Just that little house you came in and surgery was on the right, and the administration was up those stairs. And mm-hmm.
Ed Hall. Ed Hall.
Oh yeah, he was a true gentleman. Yeah, there's so many stories I love to tell, but I just really think it's better to keep my mouth shut.
Remember when Ed Kuhn came in dead? And like the only way they could tell him was the thing he had around his neck. I mean, because he was Ed Kuhn was an OB doc,
Mm-hmm.
and coming home and was a little 3 sheets to the wind,
Mm-hmm.
and came over the railroad track and went head on into a truck.
Oh,
Yeah.
Killed him, burned almost beyond recognition when they brought him in. Came there to work that morning and went through the ER.
Yeah. Mm-hmm. Well, wasn't Farnham in a bad accident too? And yeah, someone had to pull him out of the car. Someone else was out there. Mm-hmm. Yeah, there wasn't such thing as DUIs then. You just went home. You just drove home then.
Yeah. Pick them up, put them back in the car, and take them home, and don't do this again. I know that one.
Yeah. Well, I drove ambulance for Dun and Quigley funeral home. Yeah, our motto was "You're never wiggly when you're done by Dun and Quigley," and that's all you do. You picked them up, you put them in the ambulance, and you drove to the hospital. You never start an IV or ask them what was wrong. You just get them to the hospital. That was it. Yeah, now they're treating them on the way. They're transmitting EKGs. They're giving IV medications and everything on the way. So, did I say such changes I've seen in my short life?
On the ambulance, it used to be they would listen to the monitor radios and they would race to see who could get there
which
first.
ambulance could get there
And then
first.
the second ones would be racing to the tow truck company.
Yeah, yeah.
Oh my.
We're going to have to talk to Ed. He said he just doesn't want it videoed. He just wants to talk.
Well, what? I mean, it doesn't make any difference. You don't even know that there's a camera there. You just, like I talk to you most of the time. I found that's the easiest way is pick out somebody in the audience and talk to them.
Maybe once he sees that it's a relaxed atmosphere and it's not this big camera. And
Nancy said, "Well, why doesn't he want to do that?" Well, you never know. I mean, maybe he was to the dermatologist and he's got half his face frozen from stuff. That's what I got to do tomorrow.
Yeah, well, I just had that, frozen off my lip. It's the same thing. Who's doing it?
Long.
Oh.
Long.
Yeah, I had a little brown spot there, and that's what this whole big flap is. They took the whole thing off. Here you go. Yeah, you can show them something really ugly. Yeah, but Farnham has really seen the stories too.
Yeah, he's 94 now.
Yeah, he just sold his airplane.
Yeah,
mm-hmm.
Just sold his airplane. He's flying up until last year. Yeah, it is.
Yeah, his story was, I admitted this patient with a bowel obstruction. He says, all you got to do is NG tube, put it at rest, it'll make it. He'll decompress and she'll do fine. I said, no, sure. So we went through 2 days, and on the third day she wasn't any better. And he says, give her one more day and she'll recover from this thing. So he went to Wellington to operate, and I got hold of Chin. I said, Chin, come on in here. And we operated, and it was all straggly. It couldn't do it. So he came to my office and he wrote, I told you so, I told you so, I told you so. And he said, here, I'm going to hang that on the wall. I gave you 3 I told you so's. Yeah, he was my, everything was just so simple that time. I had a fractured nose and I had the cast. I said, what do I do with this thing? And I would go down to his office and he said, well, this is where you put it in and how you do it and everything. And I thought, oh, great. And then he'd come up, what the heck's this rash I got here? And everybody everybody just, just took care of things.
So between doctors today, does that happen?
No, not so much. No, they asked me in the past 55 years of working with residents, what's the biggest change that I've seen? I said, the new residents, I'm not able to pronounce her name. And it's just, they just don't. I mean, it's nothing against them, but they want a job from 7 to 3:30 and be home with their children. They don't want to stay late. They don't want to work weekends. They don't want to work holidays. You know, they've got their family to take care of. So it's more of a business.
How many gals did you have in your med school?
25 we had all in the office, staff.
No, in your medical school class.
5 out of the 150.
In the class,
Mhm.
and I think we had 6 women.
Right.
Now, it's like 60% women.
Right.
Oh, okay.
Right.
And nothing, I think they're great, but they take time off to have babies. They want to stay home. So you end up probably getting maybe 60% of a full
Right.
practicing position out of that because they're off for having kids and raising kids and things like that. So out of the 150, now you're only getting really maybe 90 full.
Right.
And I don't know. I don't
But-
understand.
But they're great. I mean, like, do you know Glenna Jackson, my partner? Yeah. Because it was tradition when a new partner would join me, we would take vacation and then they would be solo for the first week because we didn't want to be hangover. Okay, do this. Okay, refer here. You know, we didn't want to be telling them everything. So we took off when Glenna came, and I came back after vacation. I asked our nurse, I said, how was it last week? She said, oh my God, it was absolutely horrible. We had patients coming in here at 7:30. We had to send out for cheeseburgers for lunch. We had to go right through lunch. We didn't get out of here until 8 o'clock at night. This office was just jammed with people, you know. Then I saw Glenn. I said, hey, Glenn, how was it? He said, well, I just say we'll never do that again. That's all she ever said.
What year did you have when was that you had your
2 or 3 years ago. Mm-hmm.
Oh, there's-
Afterwards, she says, oh, I'm so glad you're 80 instead of 18. She says, I got so much skin to work with here. Yeah, she was great too.
Who did it?
It was down in Florida.
Oh yeah. That's right.
Mm-hmm. Done down there. Yeah. Yeah, remember Dr. Carson had his little office right there where I think it's the women's rehab or something place now, right there at 8 on Washington Street, right by the cemetery,
Yeah.
right a catty corner from the church.
Is that an apartment building now, or what is that?
I thought it was for rescue for women, the abused women or something that they can park in there. That's why the parking lot is all. That's why the parking lot's enclosed. Yeah, you can't see whose car is in there, and they try to keep it that way. But yeah,
It used to be, I thought, that no one knew where that was, that only a few police officers or knew, but now I think we all know.
It's more open now. I'm
Yeah, I
not sure
went to
that's
do
good
a
or bad.
donation to them and they met me in a parking lot.
Did they?
Yeah.
Well,
So
Yeah, I was in Rotary and we actually got to tour that, it was the older,
Right, yeah.
before they did the upgrade.
I think that was good.
Yes, very good.
Yeah.
Very informative.
yeah, all right.